Hello, everyone. Good evening for all of you. And thank you very much for your attendance today about the revision for the last Kaps exam, the coming exam on November 2024. In this revision, we will discuss different topics of the Kaps exam by the way of discussing the questions, discussing the recent questions that present previously in the last exams. In this revision, you will have 6 sessions. 2 of them are free and 4 are paid. This is the first free one. So this is the composition of the revision content. We have 2 free sessions and 4 full revision lectures plus mock test at the end. Okay, the schedule for this revision will be today is the first free one. Then we'll have another lecture in the coming Monday. Will be about paper 1. It's not free. We'll discuss about 120 questions of paper 1, most recent questions from paper 1. Then on the coming Thursday, we'll have the paper 2. In the coming Saturday, the second free one. Then in November 11, we will have the third complete revision about paper 1 and paper 2, both papers. And finally, the last one will be about the most recent recall, which was present in the last couple of exams. In this revision, we will discuss questions and answers. Questions, full statement of the questions, okay, plus full 4 choices, and we'll see the right choice and the rationale for the right choice, why we choose this right choice. Okay, also we will learn the concept of the questions so that if the question will be changed in the exam, you will be able to answer it very easily. Okay, I will make all of you mute, and please, if you have any question at any time, open your mic and ask about it directly. Okay, so let us start. The first question today. An example of transporter protein which are embedded in the lipid bilayer of the cell membrane. Which one? P-glycoprotein, cytochrome 3A4, adenosine triphosphate, or alanine. The transporter protein here is the P-glycoprotein. What is the meaning of transporter protein here? Transporter protein will transport the substance from one side to another side. Its function is to, this is the transporter protein, suppose this is the transporter protein, and here the GIT, for example, and here the blood stream. The transporter protein here will bind to the substance that need to be absorbed, then reject its absorption, making it going back to the GIT and decrease the absorption. So when we mention that any substance that is substrate to P-glycoprotein, it means that its absorption will be affected by P-glycoprotein, and its absorption will be decreased. Decrease in absorption. Okay, so what is the impact of that? This is one of the important sites of interactions. If we have a substance or a drug that is substrate to P-glycoprotein, and we have another drug that inhibits P-glycoprotein, what will happen? here, the inhibition for P-glycoprotein will allow the drug to be absorbed. More absorption. The result here is more absorption, which may lead to more toxicity. We have one of the famous examples in this part, the interaction between digoxin plus amiodarone. Digoxin and amiodarone. Digoxin is a substrate to P-glycoprotein, while amiodarone is an inhibitor to P-glycoprotein. So, amiodarone here will inhibit the P-glycoprotein so that digoxin will be absorbed more and more, which may lead to more toxicity. Okay, this is about the P-glycoprotein. So that the right answer for this question, which is P-glycoprotein. The second question, repeated several times in some of the previous exams, usually used as a diagnostic test for active TB. The key word for this question is the word active TB. We have several tests to diagnose the TB, the tuberculosis. Includes the blood test, the skin test, the chest X-ray. Okay, but which of those is used for the active one? Tuberculin mantox test, which is the skin test, or chest X-ray, nucleic acid amplification test, or TB skin test. Here we need to know the active TB. The active TB can be diagnosed by two tests, either chest X-ray or sputum test. Chest X-ray is a valuable screening tool to determine which patient should be referred for TB diagnostic tests. Okay, it will diagnose the active TB, while the skin test or tuberculin mantox test is a type of hypersensitivity type 4. This test will check the presence of antibodies. Okay, so the antibodies here means that the patient here was infected previously or recently. It will not define either recently or previously with the TB, but this will indicate that the presence of antibodies means that the patient having the antigen. This antigen may be due to the vaccine. The vaccine may generate the antibodies, so it will not indicate either the TB is active now or latent. Okay, however, it is one of the important tests for the TB, the tuberculin mantox test. The next question. Which of the following opioid is least likely to cause serotonin syndrome? Let us firstly see what is the serotonin syndrome. Serotonin syndrome is a potentially life-threatening condition occur when there is two or more serotonin enhancer. Or two drugs or more increasing serotonin level, either caused by medication, drugs, or supplements that increase serotonin level or activity, either alone or combination. The opioids are drugs that may increase serotonin. So when used with another drug increasing serotonin like SSRIs or MAO inhibitors, the serotonin syndrome may occur. Some of opioids that can cause serotonin syndrome are those that have serotonergic properties like serotonin reuptake inhibitors. So let us see the choices here. We have morphine, tramadol, fentanyl, methadone. We are talking about, or we are looking for, which is the least one, which is the lowest one, or even does not cause serotonin syndrome. The right answer here is morphine. Okay, the right answer is morphine. Some opioids have a high serotonin effect, like methadone, dextromethorphan, and tapentadol. Other opioids that can cause serotonin syndrome are those that interact with other serotonergic medications, such as antidepressants, migraine medicine, and other drugs like fentanyl, oxycodone, hydromorphone, and morphine. So here the lowest one is morphine regarding to those choices. Morphine, its effect on serotonin level less than the others. Why we choose morphine? Morphine, its effect on serotonin less than the others. So its interaction with other serotonin enhancers is less than the others. We have a list of drugs that are lowest, morphine one of them, plus fentanyl, but morphine is lower, oxycodone, hydromorphone, and hydrocodone. Okay, so if you have a question like this, morphine is the choice.
Sir,
Please.
what if the question comes vice versa, like the most likely to cause serotonin syndrome?
Most, you'll have the methadone. If the question change it to be the most, you have the most here instead of least, you have the most. So through those choices, we have methadone. Okay, other choices, if methadone is not present, meperidine can be the choice. Tramadol, meperidine, dextromethorphan, all of them have a high level of serotonin or high effect on serotonin level. Okay, the next one. Which of the following is not a correct match? Here we have some conditions and the cause of them. Is it right or wrong? Let us see each one. Hypoparathyroidism cause hypocalcemia, or hypoparathyroidism cause hyperphosphatemia. Hyperparathyroidism cause hypercalcemia, or hyperparathyroidism cause the deficiency of calcium. We are looking for which is not a correct match. Let us see each of them, is it right or wrong? But before that, let us see the relationship between parathyroid hormone and calcium. Okay, parathyroid hormone is like vitamin D in its action. It will lead to 3 mechanisms. All of them leads to increasing calcium. Increase absorption from GIT. Increase reabsorption from kidney. Increase resorption from bones. All those three actions leads to increase calcium level. Okay, so the final result is increasing calcium level. So the hyperparathyroidism will lead to hypercalcemia. Okay, therefore this statement is right. Number C is right. Hypoparathyroidism will lead to hypocalcemia. Of course, it is right. Hypoparathyroidism causes hyperphosphatemia. Is it right or wrong? Let us see the relationship. Here we should know the relationship between calcium and phosphate. Both of them are opposite to each other because they will form a chelate with each other. So the increasing of calcium will decrease phosphate, and decreasing of calcium will increase phosphate, and vice versa. Each of them will affect the other. Okay. Here we have an increase in calcium. Increase in calcium. So decrease in phosphate. Or if we have decrease in calcium, we have increase in phosphate. Hypoparathyroidism means decrease in calcium, so increase in phosphate. Okay, so this is the right statement also. Therefore, the last one is a wrong. Hyperparathyroidism causes deficiency of calcium, which is wrong statement. Please don't forget this relationship. It is important to memorize it. Here, again, the effect of parathyroid hormone on calcium. It will increase the calcium from kidney by increasing reabsorption, from the bone by increasing resorption, and from the GIT by increasing absorption. It's same like vitamin D. Vitamin D do this the same action of parathyroid hormone. The next question. What would be the loading dose for a drug if desired peak concentration is 20 microgram per milliliter, steady state plasma concentration? If the apparent volume of distribution is 4.5 liter. Here we have a calculation problem. For the calculation problem, let us see how can we solve it. We need to know the loading dose. We have here two information. First one is the CSS, which is 20 microgram per ml, and the volume of distribution, which is 4.5 liter. In order to solve any calculation problem regarding to the pharmacokinetics, we need two things. The first one is to know the formula. Which formula you will use to solve the question? The formula here is that loading dose equal CSS multiplied by VD. Can we use the both numbers directly? 20 multiplied by 4.5? It may give a wrong answer. Why? Because you should make the units are compatible to each other. All the units should be similar. The units of the weight, the units of the volume, and the units of the time as well. The answer here should be by milligrams. So the weight should be by milligram. Here we have the weight by microgram. Therefore, we need to convert this 20 microgram into milligram by which calculation step? By dividing by 1000. Okay, so it will be 20 over 1000 to convert this into milligram, not microgram. The second step, check the volume of distribution. Here we have milliliter and here we have liter. So this should be by milliliter. Therefore, it should be multiplied by 1000. So 4.5 multiplied by 1000 in order to get the right answer in milligrams. Finally, you'll find that you can multiply directly, but you should do the step to avoid any mistake regarding the unit. Okay. So the answer here should be, or will be, 90 milligrams. Do you have any question about this calculation problem? Let us see the next question. Which of the following is a reason why ticarcellin is preferred over carbapenem? Let us see the choices. Ticarcellin has a broader antimicrobial coverage, or has a lower risk of allergic reactions, or has a longer half-life in the body, or has a lower incidence of gastrointestinal side effects. The right answer for this question is A. Ticarcellin has a broader antimicrobial coverage. Ticarcellin is a penicillin antibiotic, also carbapenem. Okay. The penicillin antibiotic that exhibit a wider spectrum of activity compared to carbapenem is effective against both gram-positive and gram-negative organisms, including Pseudomonas aeruginosa. So it is considered as one of the anti-pseudomonal drugs, while carbapenem, on the other hand, has a limited activity against gram-negative organisms and is mainly used against certain gram-positive bacteria. While allergic reactions can occur with any penicillin antibiotic, there is no evidence to suggest that ticarcellin has a lower risk of allergic compared to carbapenem. And the half-life and gastrointestinal side effects may vary for different individuals, but are not specific differentiating factors between ticarcellin and carbapenem. Therefore, the right answer here will be A. The next question. In moderate exercise, all happened except. Let us see the choices. Increase cardiac output, increase TPR. What are those? TPR, T is the temperature, P is the pulse, and R is the respiration. Decrease in blood flow to the viscera, or increase in diastolic pressure. All will happen except. What is the exception? Here we are talking about a moderate exercise. In the moderate exercise, the cardiovascular system undergoes various changes to meet the increased demand of oxygen and nutrients. It will affect the cardiac output. The cardiac output will increase. So this will happen. The temperature will increase, and pulse will increase, and respiration will increase. Also, the heart rate will increase to pump blood faster and meet the increased demand. And increasing systolic blood pressure. Okay, the blood will be directed during the exercise to the muscles, so its flow to the viscera will decrease. Okay, while diastolic blood pressure will not increase. Diastolic blood pressure, which represents the pressure in the arteries during the heart relaxation. Okay, this diastolic blood pressure will not increase during the moderate exercise. It may decrease sometimes, may decrease slightly due to widening of blood vessels or vasodilation in response to the increased cardiac output. So the correct answer here is diastolic blood pressure increase will not happen. Let us see a question related to the structures or the chemistry. What is the name of the heterocyclic organic compound present in primacaine? The main nucleus of this structure. What is the main nucleus and what is the nomenclature of this nucleus, this heterocyclic compound or ring? Here the ring is two rings fused together. One of them is a six-member ring containing nitrogen and the other is benzene ring. When we have this ring, what we called it, let me draw it by another way. This is the ring. Is it quinoline ring, isoquinoline, pyridazole, or indole ring? It is quinoline ring. Okay, this ring is quinoline ring. Quinoline ring characterized by the presence of nitrogen here. While if the nitrogen present here in this position, we called it isoquinoline. Okay, it is found in several molecules or several drugs like quinine, quinidine, chloroquine, primaquine, plus the quinolone antibiotics, ciprofloxacin, levofloxacin, moxifloxacin, all of them containing this quinoline ring. I called it Q group. Why Q group? All drugs containing quinoline ring, like quinine, quinidine, chloroquine, primaquine, plus quinolone antibiotics, ciprofloxacin, levofloxacin, moxifloxacin. All of them will lead to one important side effect, which is QT prolongation. Okay, therefore I called it Q group. Let us take a look about some points about nomenclature of the rings, heterocyclic rings. Okay, for heterocyclic rings, if we have a 5-member ring, it ended by ol or olidine if it is completely saturated. If have any unsaturated, so ended by ol. While 6-member ring ended by ine. 7-member ring ended by epine. Okay, then the presence of nitrogen, the nitrogen called as or pyre. So if we have two nitrogens, either called diaz or pyre-as. There is no one rule. The rules may have some exceptions. So this is the most common rules used. Okay, if we have oxygen, so it will be ox. Or sulfur, it will be thi. So if we have oxygen and nitrogen, so they will call ox-as. If we have nitrogen and sulfur, thi-as. Pyrazole or pyrazole ring. How can we draw this ring? Pyrazole ring. Pyre-as. So we have two nitrogens. All means 5-member ring. Five-member, not six-member. So this is the pyrazole ring. Okay, 5-member ring containing two nitrogen. This is one of the examples of the nomenclature. If we have any other question like this, we will explain more about these points. Let us see the next question. Hyperventilation is a condition that leads to, it's an important point to understand this question very well. Hyperventilation will lead to what? What will happen when there is an increase in ventilation rate? What about carbon dioxide level? Is it increase or decrease in the blood? Yes, of course, it will decrease in the blood. When there is a hyperventilation, increase respiration rate, the exhalation of carbon dioxide will increase so that it will decrease in the blood. Its level will decrease, means that the blood pH will increase or decrease. The blood becomes more basic or less acidic, so increase in pH, and there is an alkalosis. We call this a respiratory alkalosis because the main cause is the lung. Increasing in pH or respiratory alkalosis. Let us see the choices for this one. Hyperventilation is a condition that leads to lowered carbon dioxide concentration followed by raising pH. Yes, of course, it is a right statement. What about the others? High carbon dioxide concentration is wrong. Lowered carbon dioxide concentration followed by lower pH, it is wrong. Okay. Interaction between aripiprazole plus diltiazem. The type of interaction here. The first thing that you should think about when we have two drugs is the metabolism of one of them. Does one of them affecting enzymes or not? Is it inducers or inhibitors? Of course, here we have one of the common inhibitors, which is diltiazem. Diltiazem is an inhibitor to cytochrome. So what does it cause to aripiprazole? Inhibitor leads to increase the level of the other concomitant drug. So it will increase the level of aripiprazole. If we have this choice, it will be the right answer. Yes, increase the aripiprazole level, which is the right answer here. Which substances listed below that may not enhance the toxic effect of methotrexate? Okay. We are looking for which substance will not affect or will not enhance the toxic effect of methotrexate. It is one of the questions repeated several times previously in the last exams. Ethanol, trimethoprim, cyclosporin, or salicylates. It is ethanol. Okay. Here I have a question in the chat about the hyperventilation again. For hyperventilation question, the answer is decreasing in carbon dioxide and raising in the pH. The pH level will increase and the carbon dioxide will decrease. So the answer is number A, or the choice A. Okay. Let us see the next one. The most appropriate action in the combination of daunorubicin and amiodarone. Let us firstly see what is the daunorubicin. Daunorubicin is one of the chemotherapeutic agents. It's anthraquinone. Daunorubicin, the main side effect of it is daunorubicin leads to cardiac toxicity. If we use it with amiodarone. The interaction here may lead to QT prolongation, okay, and may lead to sudden death. So the most appropriate action of this interaction is the prolongation of QT, and sudden death may occur. You know what is the drug that used to protect against cardiac toxicity from downrapacine? What is its name? Yes, dexrazoxane. Dexrazoxane is the drug that used to decrease the cardiac toxicity of rubicin family as a general, especially downrapacine. Which has fastest blood flow? Also, this is one of the questions from the previous exams. Fastest blood flow means that the way is a wide. It's like a highway for cars. So when the way is more wider, the speed of the cars will be more faster. Therefore, the wider blood vessel will have a faster blood flow, so that the arteries has a wider and fastest blood flow. Treatment of trichomonas vaginalis. Trichomonas vaginalis here can be treated by metronidazole, amoxicillin, doxycycline, or miconazole. It's not fungal infection, so miconazole is not choice. Okay, while amoxicillin and doxycycline can be used, but the metronidazole is the best one. Metronidazole is the best one, so the answer here is metronidazole. For the first order kinetic, the half-life of the drug. This question, please pay your attention with me to understand it. Okay, increase as the dose increase, or decrease as the dose increase, or decrease as the dose decrease, or remain constant at any dose change. What is the meaning of first order kinetic? Here, take care. We are not talking about the rate of elimination. Here we are talking about the first order kinetics. In first order kinetics, as the dose increase, the concentration of the drug in the blood will increase. Okay, here we have a relationship between the dose and concentration of the drug in the blood. So there is no factors affecting the increasing concentration. The pharmacokinetic parameters will not change. All of them will be constant, not affected by increasing the dose. So they are dose independent. Therefore, the T half will be constant, remain constant. And in another question, it's called dose independent. So it will not affect by the dose. However, the dose increase or decrease, the T half becomes constant. This is the most common drugs, most drugs having a specific T half. While in zero order, it will be affected. Okay, the T half depend on the dose. As the dose increase, the T half may increase or decrease because the concentration here will be affected. Which drug against nausea is not used in pregnancy? It is one of the common questions repeated several times previously. Let us see the choices and what is the right answer for this. Pyridoxine, diphenhydramine, metoclopramide, or prochlorperazine. We have two choices may lead to confusion. The metoclopramide or prochlorperazine. Okay? While pyridoxine is a safe and diphenhydramine is a safe drug. What about metoclopramide and prochlorperazine, which is less safer? The answer here is prochlorperazine. It is not used in pregnancy. It is an antipsychotic, anti-emetic drug. Can relieve the nausea. However, it can also cause a serious side effects like extrapyramidal symptoms, neuroleptic malignant syndrome, and allow blood pressure and decrease the blood pressure. So prochlorperazine is classified as a pregnancy category C by the FDA, which means that the animal studies have shown adverse effect on the fetus. Okay, so the prochlorperazine is the right choice for this question. Let us see one of the calculation problem here. If the drug infusion rate is 750 milligrams every 6 hours, and the clearance is 8.3 liter per hour, what is the steady state concentration? Okay, how can we solve this question? Let us see what are the information that we have and what is the formula, then see how can we solve. We have the infusion rate, which is 750 milligrams every 6 hours. Okay. The clearance, total clearance equal 8.3 liter per hour. We need the steady state concentration. What is the formula? Steady state concentration, mostly here we have milligram per liter. So let us put it milligram per liter. What is the formula that we can use here? We have a formula saying that CSS equal R over total clearance. Can you divide 750 over 8.3 directly? No. We should check the units previously. The units of the weight, milligrams. Yes, okay, there is no problem. The unit of the volume, liter. So there is no problem. But still we have the unit of the time. Don't forget the unit of the time. It is one of the important units. Here the time is 6 hours, while here is 1 hour. So we should not divide 750 over 8.3. It will be wrong answer. What will we do? Firstly, you should convert this into 1 hour. 750 milligrams every 6 hours. So how many milligrams every 1 hour? It will be 125 milligrams every 1 hour. Now here we can divide 125 over 8.3 to get the right answer, which is B. Okay? Questions of pharmacokinetics are very easy, but you should take care about the units and you should know the formula very well. First generation antipsychotic primary mechanism of action. What is the primary mechanism of the first generation antipsychotics? Like what? Like chlorpromazine, thioridazine, haloperidol. So what is the primary mechanism of action? Inhibiting dopamine neurotransmission, which is the right answer. The first effect regarding to dopamine. Why we use the first generation? Or to decrease or to increase, to decrease the dopamine level. However, some of them have another mechanism, not only one mechanism, like the phenothiazines. They have another mechanism, which is anticholinergic effect, antihistaminic effect, and alpha one blocking effect. Okay, but the primary one is the dopaminergic effect. Steady state concentration achieved when we achieve the steady state concentration. When the amount absorbed equals the amount excreted, or the clearance rate more than absorption rate, or the infusion rate more than clearance rate, or the protein binding extremely high. Of course, it is achieved when there is a balance between the rate of absorption and rate of excretion. So finally, the concentration in the blood becomes stable. What is the sorbitan monostearate? Sorbitan monostearate, is it giving oil in water emulsion, or water in oil emulsion, or anionic surfactant, or cationic surfactant? Firstly, sorbitan monostearate or SPEN, it is non-ionic surfactants, not anionic or cationic, commonly used in production of emulsions. Its HLB level less than 9, so it is oily. Therefore, the continuous phase should be oil. Therefore, it will give water in oil emulsion. We have 5 antibodies. Those 5 antibodies, I, G, A, M, G, E, and D. Okay? A, M, G, E, and D. There is no other types of antibodies. Okay? Each of them have a specific characters. Let us put them together to see the right answer of this question, and also any other question like this, how can we solve it? So let us put from 9 to 10 important points, and you can write them with me. The antibody that presents in external body fluids. External body fluids, here have the A. The antibody involved in hypersensitivity reaction or allergic reaction, hypersensitivity type 1. It is E. Okay. The antibody that is the most common, or sometimes called most abundant, it is G. The antibody that presents in all body fluids, including the milk, is G. The antibody that can pass the placenta, it is G. So if it is past the placenta, it can give the neonatal immunity or protect fetus. So the antibody that give a neonatal immunity is G. Okay. The antibody that is most potent, it is M. Okay. The antibody or first secreted when there is an infection, Also, it is M. The antibody responsible for adaptive immunity. It is G. While innate immunity, it is M. Okay, those 10 notes are very important. So if you have any question like this about any of those points, you can answer it directly. Let us see our question here. The antibodies that capable for crossing placenta, of course, here the point number 5, it is G. So that answer is G. Okay, I'll give you 1 minute to write those notes. Then we will transfer to the next question. Yes, do you have a question?
So what is the difference between most common and most potent?
Most common is the number of immunoglobulin. Okay, number of it is the most common. While most potent means most effective or more powerful is M in this case. There is no note about immunoglobulin D. It's unknown, or there is no study suggest what is the function, the accurate function for it. So there is no note about it. Okay, let us go to the next one. The structure of Zwitter ion, also a common question repeated several times. Here we have 4 structures, all of them for the amino acid. Which of them is called Zwitter ion? Let us understand firstly what is the meaning of Zwitter ion. Zwitter ion means that the ion that contain positive and negative charge at the same time when it is present in a neutral media. So here we have 2 charges at the same time, positive and negative. This is the Zwitter ion. Okay, by the way, let us revise the structure of the amino acid. Amino acid, or especially the alpha amino acid. Here we have 2 functional groups, carboxylic group and amino group. Carboxylic group and amino group, the amino group present in the alpha carbon. What is the alpha carbon? Is the first carbon adjacent to the carboxylic group. Okay, so here this is the alpha carbon, and here the amino group. So we called it alpha amino acid. This alpha carbon, mostly it will be chiral center because it's surrounded by 4 different functional groups. So here we have stereoisomers for the amino acids. The 2 characters or 2 functional groups give the amino acids 2 characters, basic and acidic. So in acidic medium, it will act as a basic compound, while in basic medium, it will act as basic compound, while in neutral medium, it will carry both charges. So we called it Zwitter ion. Any other compound having the same character, having both charges, so we called it Zwitter ion. Hypophosphatemia, refer rise in. Again, what is the relation between calcium and phosphate? It is an opposite relationship. Calcium increase mean phosphate decrease. Calcium decrease means phosphate increase, and vice versa, because they will form a chelate with each other. Therefore, the right answer here will be the calcium level. Mechanism of action of lamivudine. Lamivudine is one of the antiviral agents. Also, it's considered as one of the drugs used to treat the human immunodeficiency virus, HIV. We have main 5 mechanisms of those drugs, the heart. The mechanisms either NRTI or nucleoside reverse transcriptase inhibitor, non-nucleoside reverse transcriptase inhibitor, nucleotide reverse transcriptase inhibitor, protease inhibitor, and fusion inhibitor. Okay. Nucleotide, we have tenofovir. Fusion, we have enfuveritide. Tenofovir by T, enfuveritide containing FU. Protease inhibitors, all of them ended by there, except tenofovir and abacavir. Tenofovir is a nucleotide reverse transcriptase inhibitor, and abacavir is nucleoside reverse transcriptase inhibitor. Okay. In the group of the nucleoside, we have abacavir, didanosine, and vudine family. Vudine family including zidovudine, lamivudine, and stavudine. So lamivudine is nucleoside reverse transcriptase inhibitor. Okay. Lamivudine also have another important use. It is the first line treatment of hepatitis B virus. The next question. The most appropriate action for patients on doxorubicin chemotherapy and the physician prescribed glucosamine to relieve his mild osteoarthritis symptoms. First question here. Is there any interaction between both? The answer is yes. So, what is your response? The most appropriate action. When we have two drugs, drug A and drug B, both of them will lead to interaction and serious interaction. How can you answer a question like this? Firstly, looking to both drugs. Are both important or not? Can we replace one of them with other drugs or not? In our case here, doxorubicin is an important one, while glucosamine is not the first line for osteoporosis or osteoarthritis. Okay, glucosamine is just an adjunctive therapy, so we can replace it with another drug. Therefore, the right answer here is replace glucosamine with another drug, because it is not the main drug of osteoarthritis and we can replace it. We can use another drug which will not interact with doxorubicin.
Excuse me, sir, I have a question.
Yes, please.
What is the actual interaction between both? Don't know.
Glucosamine will increase the cardiac toxicity of doxorubicin. It will increase the cardiac toxicity of doxorubicin. So here we should replace glucosamine with another drug. Which of the following vaccine do not cause active immunity? What is the difference between active immunity and passive immunity? For active immunity here, we let the body generate its own immune system or generate its own antibodies. While passive immunity, we just give the antibodies directly or immunoglobulins directly. Okay, therefore, for active immunity, it will be a vaccine or toxoid. While passive will be immunoglobulin. So that when we see the choices, here we have hepatitis B immunoglobulin is a passive, while live attenuated vaccine and MMR vaccine, polio vaccine, so they are active immunity or give active immunity to the body. Let us see this calculation problem. A patient bring you a prescription for 16 milliequivalents potassium chloride. Your pharmacy has 600 milligrams of potassium chloride in controlled release tablet. So the formula that present for potassium chloride is controlled release, which each tablet contain 600 milligrams. So how many tablets you can use to prepare this prescription? Firstly, we need to know the weight of potassium chloride present in these milliequivalents. 16 milliequivalents means how many milligrams? How can we know that? By the formula. Formula saying that milliequivalents equal weight over molecular weight over the small n, which is the valency. So the weight equal the milliequivalents, which is 16 multiplied by the molecular weight, 74.5 over the small n, which is 1 here. So let us multiply or do this calculation. 16 multiplied by 74.5, it will be 1192 milligrams. Okay, this is the weight. Now, this weight present in how many tablets? Each one tablet contain 600 milligrams. We have approximately 12,000 milligrams. So they are present in 2 tablets. Okay, it's a very easy question. Here another question about structure. The compound shown below inhibit which of the following enzyme? Firstly, we need to know what is the structure, then we will know what is the drug or what is its mechanism of action. This structure is similar to purine ring, which present in dancine. It is not thiophalline. Purine ring, what is the difference between this structure and the purine ring? Let us see. Purine ring having the same number of nitrogen, the same number of rings, but here there is a separation between the 2 nitrogens. This is the purine and this is the other one. The similarity is very close to each other. Okay, thiophalline is a methyl dancine containing methyl group, but there is no methyl group here. This is the dancine structure. Okay, this is the dancine oxidase inhibitor, the allopyranol. So this structure is the allopyranol. It is dancine oxidase inhibitor. Let's see the next one, which is not pyrimidine. As you know, we have two nucleus for the bases of DNA and RNA, purine and pyrimidine. What is the difference? We just draw the purine. This is the purine ring, while pyrimidine is only one ring containing two nitrogens. What are the bases of purine? We have two bases only, adenine and guanine. While pyrimidine ring, we have three bases, thymine, uracil, and cytosine. Okay? Which is not pyrimidine, of course, it will be adenine. Uracil is present in RNA, while thymine present only in DNA. Cytosine present in both DNA and RNA. Adenine and guanine also present in both. The last question today. Which drug have different crystal structure, or the presence of different crystal structure? What does it mean? Polymorphism, solubility, crystallities, or drug forms? The different crystal structure means polymorphism, which will give different physical characters. Different in density, different in solubility, different in shape, different in hardness. So the physical character of the two crystal forms of the polymorphism will be changed. However, the structure or the formula may be the same. Okay? This was the last question today. I hope it was useful revision for all of you. Of course, the questions that we discussed present in some of the previous exams, so the repetition of them may happen. Either the same question or a question having the same concept and the same idea. Still, we have another one free lecture in the coming Saturday. Also, we have the full revision with another 4 lectures about paper 1, paper 2, paper 1 and 2, and the most recent recourse. So for reservation for the full revision, you can join the full revision from the website and from this link, or contact me in my WhatsApp number. This is my WhatsApp. Okay, the full revision includes the mock test also. Okay, this lecture was recorded and I will distribute it either in the website or in the YouTube or the Facebook. All of them will contain this lecture after uploading of it. Okay. You have any question before we finish our lecture today or our session today?
Doctor,
Yes.
can you repeat the question about the methotrexate and ethanol?
Methotrexate and ethanol. Here the question answer was ethanol. Ethanol
Yes.
is the lowest one that affect methotrexate. Let us go back to see it. Yes. Which substance listed below that may not enhance the toxic effect of methotrexate? Okay. Ethanol is the lowest one, which will not enhance the toxic effect of methotrexate, while others may affect the toxic effect, each of them having its specific reason. For example, the trimethoprim sulfamethoxazole, they will affect the folic acid. They will decrease the folic acid. They are antifolate. And as you know, folic acid is important for methotrexate. If folic acid decreases, the toxicity of methotrexate will increase. Cyclosporin is an inhibitor, so increasing the level of methotrexate, so increasing its toxicity. Also, salicylate will interact with methotrexate and enhance its toxicity. Okay, so the ethanol here is the drug regarding to those choices that will not enhance the toxicity of methotrexate. It's one of the important questions and repeated several times previously as well.
All right, thank you.
You're welcome. Any other question?
مساء الخير يا دكتور، اخبار حضرتك؟
الحمد
دكتور
لله.
sorry speaking Arabic. This
Mm,
revision it will be recorded in our website.
Yes,
our
yes, yes.
account.
I'll distribute it in the website in your account. Yes, it will be present. Also present will be present in the YouTube or Facebook. All media will be present in it. Okay, so don't worry.
Okay. Thank you so much.
Okay. Yes, alcohol. Yes, Asma. Alcohol is an inducer to cytochrome. Which one? Do you know which one? I think it's like 1A2. Okay, so if you have any question later on or at any time, you can contact me on my WhatsApp number or ask me at any time you want. And when I see the question, I will answer to you. Thank you so much for your attendance today. I hope it was useful for all of you and hope you're having a good luck in your exam. Thank you and see you in the coming revision. Goodbye.
Thank you so much.
Thank you.
Bye, sir.
Hello.